Does this sound familiar? Are you or is someone you know troubled by snoring? Snoring is often the butt of jokes and can even elicit an unwelcome response. But did you know that snoring can be very unhealthy? Heavy snoring can be a symptom of a sleep disorder known as sleep apnea, when the snorer actually stops breathing during sleep. Did you know that more than 40 million Americans suffer from sleep disorders, many from sleep-disordered breathing or snoring and sleep apnea? And the consequences of snoring and sleep apnea can be very serious. For example, because they fall asleep at inappropriate times, apneics are 3 to 7 times more likely to be involved in auto accidents. The Department of Transportation estimated that 200,000 reported automobile accidents each year are sleep-related. Also, severe sleep apnea is frequently associated with high blood pressure, heart disease, stroke, and other cardiopulmonary problems. In fact, it has been estimated that 38,000 cardiovascular deaths occur annually as a result of sleep apnea. There are various treatments available for snoring and sleep apnea that range from surgery to mechanical air pumps which aid breathing. While all of these treatments are effective to some degree, they may be inappropriate for many people who only snore or have mild sleep apnea. Now, there's the TheraSnore Appliance, designed to treat snoring and mild sleep apnea. It is simple to use, comfortable to wear, and is inexpensive compared to other treatments. Listen to what these people say about the TheraSnore oral appliance.
I like the TheraSnore because I wake up in the mornings without a mild headache that I used to have. Not enough of a headache to take aspirin or Tylenol, but just a mild headache. And when I use my TheraSnore, I don't have the headache. Also, I don't get kicked during the night or punched, and that's really fun.
When we travel, Jim takes the TheraSnore with him. That is probably the first thing that he packs, and he always uses it when he's getting ready to take a sleep on the plane.
When we camp, all the adults are together and they're camping. You could just hear the different irregular snoring patterns all over, and I thought, you ain't heard nothing yet. If they ever heard Bob before he was wearing the TheraSnore, I mean, you know, the animals would have been running out of the forest, but he's the one who gets the best night's sleep. And you know, some of the other fellows have said, I've got to check into this, because, you know, their wives have said, now what is he using? We've got to get something like that for our husband.
Yeah, I've handed out a lot of the lists of the doctors who provide it over at our Boy Scout troop, because the wives notice the difference and they go, Sally came over to me, she says, Ed needs that. You know?
Hi, I'm Dr. Tom Mead, developer of the TheraSnore dental appliance for the treatment of snoring and some forms of obstructive sleep apnea. The appliance fits very firmly over the upper or maxillary teeth, while on the lower it allows the jaw to slide from side to side, but does not allow the jaw to retrude. This is very similar to CPR, where you keep the airway open by moving the mandible slightly forward and open. The first night that you wear the TheraSnore appliance should be a quiet night. If the appliance is not working to you or your mate's satisfaction, or you're having any discomfort whatsoever, return and see your doctor.
Let's look at why we snore and how the TheraSnore appliance stops the snoring noise and helps provide a quiet, comfortable night's sleep. Snoring usually occurs when your tongue and lower jaw relax during sleep and fall back into the airway. This causes a partial blockage of the airway, which reduces the amount of oxygen passing through to your lungs. Your body naturally reacts to this by increasing your respiration or breathing. This increase in the speed and pressure of your breathing causes the soft tissues at the back of the throat to vibrate, creating the snoring noise. The TheraSnore stops the snoring noise by preventing the jaw and tongue from dropping back into the airway. The TheraSnore appliance is a small, comfortable oral mouthpiece which is worn only during sleep. It takes most people only a few nights to fully adapt to wearing the appliance, and by the end of a week or so, you will be sleeping quietly and comfortably all night long. 85% of those who use the TheraSnore experience either a total elimination of snoring or a dramatic reduction in the snoring sound. The doctor is trained in evaluating patients for the TheraSnore and can tell you whether you are a good candidate for the TheraSnore. You can be fitted with the TheraSnore in only one short visit to a qualified doctor's office. A brief follow-up is usually required in about a week to evaluate your progress and make any necessary adjustments. Much like eyeglasses, the TheraSnore is painless and causes no permanent changes to your body. Your TheraSnore will last about 2 years before it will need to be adjusted or replaced. The TheraSnore is one of the least expensive medical treatments for snoring available to you today.
Well, it's kind of a funny story around our household because I always kid people about the fact that if it hadn't been for the TheraSnore, I'd probably be divorced by now, because my wife had taken to sleeping in another room, and she kept telling me how badly I snored and how I was keeping her awake at night, and I really didn't believe her. And one night she tape recorded me snoring, and I couldn't deny it any longer, and I decided at that time it was time to get help, and that's when I started wearing the TheraSnore, and it has been quite effective.
I like TheraSnore because it's effective. It's 100% effective for me. Until I found TheraSnore, I had never tried anything. I thought my situation was hopeless. I'm a recreational snorer, and it infuriates my wife. She's a kicker. I would lose sleep, she would lose sleep, and I was pretty much resigned to this. There wasn't anything I could do about it. But I got introduced to TheraSnore, and it was 100% effective from day one.
Don't spend one more night troubled by snoring. Begin to breathe easier and have a more restful night's sleep today. Your doctor providing the TheraSnore appliance is an expert and will be happy to talk with you and evaluate your condition to determine if you are a good candidate for treatment with the TheraSnore. Your doctor can also answer any questions you may have about snoring and the TheraSnore treatment itself. Don't wait. Decide today to put an end to those long, restless nights' sleep for yourself, your spouse, and even your fishing buddies.